again, thank you to all of our panelists for your time, and really just want everyone to have the opportunity to hear from you because you all bring something to the table. So hopefully we're able to get everyone working here, but we're going to go ahead and jump in. So actually, I don't like what I just did to Zoom, so we're going to change that. We're going to go back to this one. Um, so we're going to start off here with, what do you wish that you knew at the time of relapse or progression? Harvey, can I have you go ahead and start us off here?
Sure. Dalton, thanks for setting this up, and I am super excited to be with you guys this afternoon. Um, he Dalton said a little bit about kind of my history, but just to emphasize, one of the things I think that is somewhat challenging, I guess, when you first start off. I mean, I didn't even know what multiple myeloma was. I mean, it was a rare blood disease, and there just wasn't a lot. I never had known anybody that had it, just didn't know a lot about it. So, you've got all of those things. You're just trying to get up to speed. But one of the things, I guess, if you look at what I wish that I knew, um, my doctors really never talked a lot about relapse. And I get sometimes why, they want you to be, kind of concentrating on just getting your initial treatments and getting on board and getting those things done. But I think the thing I wish I would have known is my progression was pretty quick. So once I did my initial stem cells, I did my consolidation treatments. I was on a drug that lasted about 6 or 7 months, and then all of a sudden, bam! My cancer's back, and it's back worse than it was, to begin with. So I wish that the doctors would have talked a little bit about how encouraging the drugs and the treatments are if you do relapse, and so that, I guess, that would be one thing that I would talk to my physicians and my team about, is not to be apprehensive about talking about that, because um, when you hear relapse and you hear progression and those things, there's this immediate kind of shutdown, and you basically are saying, gosh, is this the end? What am I going to do? And there's so many treatments, especially for myeloma, that happen after you have maybe the two or three maybe maintenance drugs that they would typically give. There's so many great drugs that are out there, especially the one that I'm on, teclistamab. So I guess that would be my ask, is for my doctors to talk a little bit more about, hey, if you relapse, it's going to be okay, because here's the other 6 or 7 treatment options that we're going to have if that happens.
Yeah. Diane, do you have anything that you would like to add on here? Obviously, your story is a little bit different, and AML is a little bit different space. You're muted right now.
Mute myself. There you go.
There you go.
Hi.
Perfect.
Well, nice to be joining you. This is going to be an interesting discussion, since we all have such different blood cancers. I think what I'd like to add to what Harvey said is about progression. As you said, I went in September 13th after having some kind of abnormal blood cell results, and didn't know anything about leukemia, didn't know anything about AML or any of the other alphabet soups that we have for the blood cancers. And I was first diagnosed a week prior to going into MD Anderson at a different hospital with CML. And the difference between CML and AML is really the number of blasts that are in the blood. So it's really kind of how far the disease has progressed. And only a month prior to that, I had completely normal blood work. So this thing took off like a rocket ship, and it scared the heck out of me. And when I went into MD Anderson and they wanted to do another round of bone marrow, and 2 days later, my oncologist called me and said, "You need to come in. You have AML. Your blasts are so high. I want to start treatment immediately." And at the time, I was in an airport getting ready to go on a short trip. And I happily said to him, "Well, I'll see you on Monday when I get back from my trip." And he said, "No, you're not quite hearing me. Your levels are so high that I want you to start treatment immediately." And I think that, so I guess the first thing I'd like to mention is progression can be really fast, and particularly in the beginning. And in the beginning, you don't have any information. You're not grounded. You don't know what the treatment options are. You haven't even decided what facility you're going to go to have your treatment. And I think that I had no idea that the diseases could move that quickly. And I think that the second piece that I would add to what was said is that you also have to sort through what your treatment plan is going to be. So I was called in then to MD Anderson, started the discussions about what my treatment plan would be based on my genetic markers, and they put me into a clinical trial. And the clinical trial was really just a combination of venetoclax, an already approved drug, with two other chemos. And so it was a sequencing clinical trial. The drugs had all been approved, but they were trying to learn what was most effective. Well, after 30 days in the hospital, my blasts were higher than they were when I came in. So not only did the clinical trial not work, I was getting worse fast. And then I did 2 more rounds of chemo, and they changed the chemo for the third one, and that was the magic, and it put me into remission so I could begin the process to fast track into stem cell. So the takeaway from all of this is it can move really fast. It moves fast before you know how you want to cope with it and who you want to have treating you. And then I guess the piece that was really, I would like to have known more of, is that if the first drug doesn't work, there's a second drug and there's a third drug. And what I learned is there were 100 clinical trials that maybe I wasn't a perfect match for, but there were a bunch more clinical trials behind the treatment that I was given. So I look at that as hopeful. If you don't respond the first time, then they have something else. And if that you don't respond that time, there's something else. And particularly with the progress that's being made at the moment, there's just all these drugs that are coming into the arsenal of treatment options. And I look at that as a really positive thing.
Yeah, and I think that's something that both of you highlighted that's really important to know is in so many of these spaces now that there are multiple options for treatment. So if the first isn't working for you, there may be something out there, and clinical trials could also be a really good option. Um, Tagging on to this theme here is looking back, what information, advice, or support would have made you feel a little bit better when you're told about progression or about relapse? Is there anything that you can point to and say, I wish someone would have said this to me?
Was that addressed to me?
It's open, but if you want to
Okay.
take the floor.
I think that I'm not sure it was something that I would have been said to me. I wish I would have had. I did not have a coach. I didn't know anybody that had this disease. And so it really would have been just terrific to be able to talk to someone that had been through it.
Mhm. I think,
Yeah. So Dalton, same exact thing here, and that's the thing that has been helpful for me for HealthTree. And then, Diane and I were talking earlier about the drug companies have been really supportive for me with just one more connection point. But I just amplify what Diane said. The connection to those who have walked in that path
mhm,
is, for me, priceless, because
yeah.
all I need to have is a conversation with somebody who's been there and done it for 30 minutes, And a lot of the anxiety that we all go through can immediately be alleviated. So sometimes it's not that what it's we're going to go through is, terrible or painful or whatever. Sometimes it's, knowing and understanding what you're going to go through takes away so much. So, maybe the treatment is going to be hard or whatever, but when somebody who's gone through it describes it, sometimes they can just take away some of that angst that we all have. So I don't know how we do it, but my savior was a guy that I met literally the day that I went for all of my initial tests. He was there and I was climbing the wall because I was like, I'm going to go through 15 tests that I don't have any idea. I hear horrible things about them. And literally, he sat down and held my hand and looked at me and said, Harvey, I am a survivor of 13 years with the worst lymphoma that could ever be diagnosed. And you're going to be okay. And let me tell you a little bit about these tests and these things that you're going to go through. And once he did that, I could feel my body just release this anxiety. And it made all the difference. And I have never lost a connection with him. He's one of my best friends in life. And we met through this terrible cancer. And it was that one little conversation that has kept me going and just given me relief. And, when we talk about relapse and progression, he immediately told me, hey, I'm a guy that's had relapses and progressions, and I'm still here after 12 years. So it's not a death sentence. And just hearing somebody say that has gone through it, there's no book, there's no webinar, there's no anything that can take the place of that contact.
That's so well said. So well said. That's exactly correct. And I signed up to be a healthcare coach to try to do just that. And whether it's for stem cell or it's for AML, you absolutely hit it right on the head. It's just so important to be able to look to someone who you look at and say, well, now how often do you have to go to the doctor, and can you travel, and what's your life like, and oh, there is life after this disease, and oh, there can
Yeah.
be life after this treatment, and yes, you're going to lose your hair, but guess what, it comes back. So yeah.
I think that's so important to talk about that community aspect. And I've got a question built in a little bit later that we can get to that more of. But yeah, just really highlighting the importance of having that community and having people to talk to, I think is really good and really does make a difference for people. So, Ron, I don't know if you can hear me. I see you unmuted, but I don't know if you can hear me. Gonna go with no. So we're gonna go ahead and move into our next theme here, which was choosing next line treatments. This may be second line treatment, third line treatment, fourth line treatment. That's why I titled it next. But just, I wanted to know if there was anything that you could share about how you went about exploring what treatment might be right for you next. And obviously, myeloma is a very different space than AML. So those journeys may have looked a little bit different. Harvey, you
Yeah,
can go ahead and start us off.
I'll start. So this is going to sound kind of weird, but I'm actually on my 7th line of treatment.
Wow.
So some people would look at that and, so I'm 4 years into the disease. I'm high risk. So my genetics have a couple of hiccups in them that, cause mine to be a little bit more aggressive than others. So I have really relied on my team at University of Arkansas for just the design of that. So I really put a lot of faith in that. Diane and I were talking about just, I think it's so important. I tell all of my contacts, anybody that I connect with, one of the things that I look for when I searched out how do I want to start this, and who's going to be my team that's going to help me design my treatment plans. Um, I wanted a physician who was a researcher. And listen, I don't know that's probably one of the most important decisions I made, because I wanted a doctor who was the smartest guy in the room, but he was also, or she could be, the person that was on the cutting edge of what's next if this doesn't work. And so everybody I've selected was that person. And so when I think about designing, what was next, my doctors at UAMS had such a history and connection of clinical trials that I just knew, hey, whatever they kind of cue me up for, I'm I'm confident in their ability to select the right treatment for me. So I can't say enough about your initial selection. Find a person that is very well versed in your particular type of blood cancer. So I think all of us have different experiences with that, but going to a generalist and doing some of those things, I just think for blood cancer, it's a complicated cancer, and there's so many variables. And like Diane mentioned, the genetic part, you know, there's 1,000 different directions it can go when your genetics are weird or have some hiccups in them. So I think that's really important. And I guess this drug that I'm on, um, teclistamab, I was the first commercial patient in 2023 for the guys in Nashville. But my doctor at Tennessee Oncology had been doing the clinical trials for 4 years. So he was already 4 years into the trial. I was the first commercial. So I could look at him and literally say, tell me about all the patients that you've got in the trial. And so I got all of that information pulled in immediately, where he's like, hey, I've got patients that are 4 years into this, and they're still in remission, which, for me, I'm 2 years into this and I'm still in remission. And I had 6 other treatments before that didn't work.
Yeah,
So,
Yes, this is Ronald. Can you hear me?
Yes.
we can.
yes.
Okay, all right. Well, technology, thanks for the support team. I'm sorry, technical difficulty, but I can see you on one of my devices and you can hear me on another device.
Wonderful. Glad to hear from you.
So just let me know if you want to ask a specific question back to me. I know I missed the beginning opening and listened to Harvey and what he had to say. So
Yeah.
I'm on standby. Just let me know.
Perfect. If there's anything that you'd like to add about finding the next line of therapy and your perspective of being ET to myelofibrosis is a really interesting one. So if you have anything that you'd want to add about how you kind of went about finding that next line of treatment, or about what happened when you're told that you're progressing.
Yes. So my primary doctor in hospital was Kaiser, and my oncologist, hematologist, and I had a very good working relationship over the last 5 or 6 years, and managing the excessive platelet, which is my original blood cancer disorder, essential thrombocytosis. But early this year, we saw that my platelet numbers and everything, all the other, blood stem cell numbers just froze, just stopped increasing, decreasing. And clearly the next step, I went back to do a bone marrow biopsy to confirm that I was in the progressive state to myelofibrosis, MF, in the abbreviated initial of this disorder. And so once we got the confirmation on the bone marrow that I was in progression, she immediately referred me to Stanford for a bone marrow transplant, which at that point in time, early this year, I did not qualify due to the lack of symptoms versus the reward and the challenge of doing the bone marrow transplant. But it was during that conversation about the bone marrow transplant that my wife asked if they had any NPN specialists, and the transplant team said yes, and they then referred me to Dr. Somali at Stanford, who just so happened to be running a clinical trial that is targeting the genetic mutation which they discovered in my bone marrow biopsy. And so that was exciting news for us, because it's like, oh, that's a targeted medication that has not been FDA approved. It's a phase 1 study. I've had 2 infusion of this new medication since I've been accepted into this clinical trial. And then just a day, yesterday, the doctor did an exam and felt that my spleen is actually starting to reduce in the size, which is one of the metrics of bone marrow cancer overworking when the spleen kicks in. And so it's too early to say that all the symptoms are addressed, because I've only had 2 transfusions. It's a 26-week program, but it's very, very positive on, as of yesterday, that they did see some change in my symptom side, as well as a couple of my complete blood count numbers.
So that's a really that's why I built this panel, to be a little bit more. We've got myeloma perspective, we've got AML perspective, which I want to get your perspective on this, Diane, because I do think AML is going to be the most different here, but also that MPM perspective. So everyone's journey is going to look a little bit different here, but one, so happy that this trial seems to be working well for you so far, Ron. But yeah, just seeing that specialist can really make a big difference. And Harvey, you were kind of alluding to that earlier as well. And I think that can really, really be beneficial for people. But Diane, is there anything that you want to add here?
I want to just make a point, because it's really not just about the next line treatment. It's about your first line of treatment. It is absolutely critical that you do your research and don't just go to your local hospital. I think that Harvey said, you need to find someone that does a lot of treatment for the kind of disease you have. And whether for me it was CML or AML, I didn't know anybody that was in that space. And the first hospital I went to didn't have a treatment plan other than treating the symptoms, told me I was too old for stem cell, and basically didn't have any clinical trials. And so I knew it was in the wrong place. And I immediately started looking for the right place. And I think that that's just really, and by the way, that first doctor that I talked to very much encouraged me to keep looking and to find, she wasn't very helpful in terms of telling me where to go, which was right down the street to MD Anderson, but that doesn't really matter. The point is the same, which is for whether it's first line, second line, or the 7th line of treatment, you need to find people that are focused on and specialized in your kind of cancer. It was very comforting for me when I went in for my induction, my first 30 days in the hospital on my induction chemo, to be on one of 2 floors that did nothing but leukemia. So I was in a hospital that had 2 full floors. And so they had seen every symptom that I was presenting, and they had solutions for those symptoms. And, you know, you just, there's nothing wrong with community hospitals and local hospitals. And if you broke a leg, you can probably get it fixed almost anywhere. But when you get into these specialized diseases that have to have specialized knowledge, and it's great to have clinical background behind you, you just really have to shop until you feel comfortable with your team, because it absolutely it really defines the success of your outcome. So far, I haven't had to find a second line treatment. So far, everything's been going well. I'm 250 days out from my stem cell, but you know, I have very high risk genes as well, and it can come back, and then I'm going to have to figure out what my second and third line is. And you just have to trust that you've chosen the right place with the right depth of knowledge.
Well, hey, one thing, Dalton, I'll add to what Diane said. One of the things that I did find out early on, and this is something that you can do some research and find the answers. I looked at the mortality rate for patients at University of Arkansas, and their mortality rate was lower than other hospitals or other clinics. And so that was another way that you can look when you're trying to figure out, hey, are these guys really good at what they're doing? Looking at those mortality rates for their patients is one way that you can find out a quick snapshot. It's not the be all end all, but there are it is a good way to kind of eliminate some that you might think, hey, I don't know if I should look at this hospital or not. So that's another good one that you can look at.
And then we did have a question come in here that I wanted to address, even though we're not quite to the Q&A yet. But someone in the audience was asking if you all live near one of these major academic centers, because this individual is 3 hours away from one. And just something that I'd like to tell people that might be a little bit further away is oftentimes you can get a consultation with a specialist, and they can work together with your local oncologist to really coordinate your care if it's a little bit too far for you to travel for all the appointments. Obviously, every case is independent, but that is a pretty common practice where a specialist will work with your local oncologist to coordinate that care to really make sure that you're getting the best treatment available to you. So even if you're further away, you still often can at least get a second opinion or have that specialist consulting for your care.
And I meet people when I was in the leukemia clinic. I don't go there anymore. I'm in the stem cell clinic now. But when I was in the leukemia clinic, there were people literally from all over the world that were there. And many of them were post-treatment and were coming in for their quarterlies or their annuals. And as you said, they can coordinate their local support from a local oncologist, hematologist, but they come back and get checked in and kind of do a health check to see where you are. For stem cell, at least at MD Anderson, they have a lot of resources, and they provide housing for many that are out of town, because you have to be within 30 minutes. When you do stem cell, you have to be within 30 minutes for 100 days post stem cell for the leukemia stem cell anyway. And there was housing provided for us. I'm in Houston, so I'm an hour plus away. Houston traffic's horrible. We did do some commuting in the beginning, and then ended up renting an apartment downtown so that I could be 7 minutes away. Because when you're being seen 7 days a week, or you're in the hospital for 30 days, it just is almost unbearable to be making a 2 to 3 hour trip every day. But so I had the resources to rent my own place, but there were many people that I met that were supported by local housing opportunities where people could stay. And they just, there are lots of alternatives. In fact, there are people that I met in clinic that were coming in from Mobile, and there's a pilot and a whole organization that flies people from Mobile over to Houston so that they can come over for treatment. So, you just because you don't live in Houston, or just because you don't live in Little Rock, it doesn't mean that there aren't resources to help you to go there for your treatment so you can get the best treatment.
Dalton,
Absolutely.
my hospital is 6 hours away. So UAMS is about 6 hours from Nashville, but they work in concert with Tennessee Oncology, which is about 30 minutes. I'm about 30 minutes south of Nashville, so I can go in and get that treatment, which is once a month. But Diane mentioned that UAMS has countless connections where you can have housing. So, I mean, for me, I had 2 tandem stem cells and then 2 consolidations. So I was in Little Rock for about 6 months solid. I'd come home maybe for like 3 or 4 days, get stuff straight around here. And then I was back in Arkansas. So literally, I was in the hospital and in Arkansas for about 6 months, really 7 months to begin with.
All right. Our next theme that I want us to talk about here, I know a couple of you have some experience here. And it kind of also ties in with what we were just talking about, but this is going to be all about clinical trials. So just kind of what that process looks like. If you weren't on a clinical trial, did you think about exploring them? Or if you're on that trial, how you kind of coordinate that care? So, um, Ron, I see you're unmuted. Do you want to go ahead and start us off, since I know you are right in the thick of this at the moment?
Yes. Can you hear me?
Mhm.
We can.
Okay. I just want to touch on the previous conversation too about the expense, about the bone marrow transplant and the requirement to be in close proximity. On the clinical trial, depending on the sponsor of it, there's some flexibility. There is a reimbursement model that I'm entitled to, although I'm very close to Stanford. So they would normally take care of housing and food if I met the distance criteria, but because I can actually literally drive to Stanford in 10 minutes, those benefits are not available for me. But again, I'm noting that for clinical trial, usually the sponsor of the trial will have accommodation to handle local support, depending on how frequently you have to be involved in a clinical trial.
Yeah, that's a really
Okay.
good thing to point out, because not everyone knows that, but oftentimes these clinical trials will try to have, they understand that it can be a little bit harder and a little bit more just difficult for logistics. So a lot of times they will try to offer some sort of support for that. So thank you for pointing that one out.
Okay.
I think the
Uh,
biggest support that comes from most clinical trials, and not all, is that the very expensive drugs, typically you don't pay for them. My first
Mhm.
clinical trial was sponsored by a drug company. And so my very expensive baseline chemo was part of the trial, and so it was free. And what I didn't understand until I went off the trial was what that was worth, because my copay was $1,800 a month. So it was worth a lot. My second clinical trial, which came after stem cell, which is based on the same drug, doesn't have support. And so in that case, I'm not getting support from the drug company. It's a clinical trial to check, both to try to keep me from regressing, And also they're trying to see, is it more effective than not having maintenance therapy? And in that case, I'm using a drug that's already approved for this methodology. So it's not like it's not FDA approved, but it's also not paid for. So there's a really wide range of trials. I was of the belief before this started that clinical trials were very far out drugs that hadn't been tested on anything but monkeys, and that it was as a last resort, and that is like anything but the truth. And so I kind of trying to address the fear aspect of it. Is they will tell you when they talk about the trials whether the drugs are approved. What are they trying to learn? Is it the drug in combination with several other drugs to check if it's more effective that way? Were the drugs approved? Are they FDA approved? Are they not approved? I mean, you really learn quite a bit about the drugs you're being that you're going to be ingesting or going into your body, and it's not all the first commercial patient like Harvey was. Now, he's in a space that I haven't been in, but I just wanted to kind of talk about the clinical trials aren't all about space age brand new drugs. Sometimes they're just trying to learn things about the efficacy in combination with other drugs.
Yeah.
Yes, and that's true. In my case, it is a brand new medication that is not in a pill form. And so the drug itself has to be put together literally within an hour of the infusion time. And so at Stanford, they have a compound team that will mix it all up in a liquid form. And then I have to go through an infusion of 4 hours of this infusion drug in one arm, and then another couple of hours afterwards of observing to make sure there's any side effects that they could address that real time. Now, this is not obviously a release medication, but in the consent I signed that after the study is over and there has been clear benefit that I've derived from it, the manufacturer of the medication will allow me to stay on the same compound until it is approved by the FDA. And that has been something that spoke to me about the importance of involved in a clinical trial, especially when it's targeting the genetic mutation, calretriculate, that I have. It's beneficial, and some of it is uncertain in terms of the side effects and the dosage, but this trial addresses both of those and have an escalating dosage amount. And they also have a combo option on this trial where they will combine it with another release medication as well in the future.
There is such a wide variety of clinical trials, and I think both between Diane and Ron, we kind of highlighted that no two trials are really going to be the exact same. And if you have any interest in clinical trials, I highly recommend that you check them out, or at least speak with your doctor about them, because as Diane said, they're not all space age medicine, and they can have some real benefits. Harvey, I didn't know if you had anything that you wanted to weigh in on here, or if not, we might go ahead and hop to our last section, but wanted to throw it out there for you.
Yeah, I think the only thing I would add is I think we've all got to do better in embracing the clinical trial process, because I think there's a fear out there when you hear the word clinical trial, you think immediately, oh my gosh, I'm at the end of the road. This is nothing else works. And so my guys that I've been connected with they're just so encouraging to say, hey, you can still be on some standardized kind of treatment process and still be involved in a clinical trial process too. So I think we got to get that information out there where there's not this stigma on clinical trials that it's, oh my gosh, I'm at the end of the road here and that there's nothing left to do. That's all.
Yeah, thank you for bringing that up, because that is so true and such an important thing and Diane mentioned this as well, that a lot of times people associate clinical trials with being kind of last resort, and they aren't really last resort. This is just a way for researchers to learn more and really further care. So clinical trials are a wonderful thing. I did have a question that directly relates to this from the audience, but just asking if you spoke to your doctors about clinical trials, or if there are any websites that you used to explore those options. HealthTree has recently launched our clinical trial finder for all different blood cancers. So selfless plug there. But if you're part of CureHub, we can help match you with a clinical trial that you would be eligible for. So it's a really cool tool. Highly check it out. But for our panelists, how did you go about finding the clinical trials or exploring them?
Mine was simple. My doctor brought it to me. As soon as they were sorting through what my induction treatment was going to be, he immediately brought it to me. I don't know what the other 99 trials that they had that were available were, because he told me, you know, they have criteria for each one. And so that was kind of the easy process.
Same for me. My doctor was the one that introduced me to it. So, and again, it kind of goes back to what I said. Uh, it's so important for me to have a researcher and a physician both, and that, you know, just what's next on the horizon kind of conversation.
Yeah. All right. And we're going to go ahead and go to this is our last of our themes. And I'd argue one of the more important ones, but how did you find strength through support? I know we talked about the importance of that, finding that support or getting a coach earlier, but just I'd really love it if you could all expand a little bit about how you went about finding support, or what you would recommend others do, or people that might be struggling to feel that they can have someone to talk to. Just what would you recommend for those individuals? Diane, you can go ahead and start off.
Um, Well, I found, you know, I couldn't believe that a cancer hospital as big as MD Anderson had no support. And so I just kept calling departments and trying to find someone or some department. And they do have a blood cancer support network that is overseen every 2 weeks. It's an hour call from the social workers. And so I finally found a group to plug into. And um, it's been it's been really helpful. I mean, it's a little hands off. I don't have a coach yet. I've met a couple of people that are survivors of both stem cell and AML leukemia. So I've met a few people, none that are my world's best friends yet, like Harvey, but they're still, every person you talk to has a story, and you learn something from it, and you kind of learn symptoms to look out for, and coping mechanisms, and just having somebody to talk to that understands. So I did find that network, and I'm still looking for others. I mean, HealthNet came to me through one of the members of my blood cancer support group, and I kind of jumped in with both feet and signed up to be a coach and took the training, and have started coming to these sessions, because I'm still really looking for both support and knowledge, looking forward for myself, but also to give back for people that are newly diagnosed and that are going through the process. So I'm still on that journey. It's been a year now. This past weekend, it was a year since my diagnosis. So I'm pretty early on in this process.
Dalton, my experience has been you almost are going to get out of it what you put into it. So I think you've got to make an effort. So for me, it was really important to make connections. So I'm a connector by nature. That's just what I've always done through my life. So it was real easy for me. You know, if I'm sitting getting ready for a bone marrow, I'm going to strike up a conversation with somebody to ask what their experience is, and then I might make a lifelong friend in that conversation. So I think you've got to take those opportunities when you're at the hospital, when you're at the clinic, meet those around you, because you could find somebody that has exactly what you got, and then all of a sudden you're connected. But one of the things that was real helpful for me, so HealthTree has been a great resource. Other resources that I would encourage people to do, Facebook. I've got 3 big groups that I'm on that just deal with myeloma groups on Facebook. And so I can strike up a conversation with any of those people. I've actually gotten 2 of my buddies that I met through Facebook that were in a place that they didn't know what to do next. And I got them to UAMS and connected with a doctor there just by Facebook. So that's another resource. The other one I was telling Diane about are the drug companies. So Johnson and Johnson, Pfizer, those guys are all, they have the same kind of systems that we're dealing with right now through HealthTree. They've got those same systems through their drug companies. And I do webinars and all kinds of things through Johnson and Johnson just to talk about specifically teclistamab and drugs in specific that I've used. Even through Pfizer was another one. So drug companies, any of the connection points like HealthTree, and then some of your social medias are great places to get to know people.
Ron, is there anything you want to add about how you can find a community, or at least finding support? I'm hoping you can still hear us.
Can you hear me?
Mhm.
We
Can you
can.
hear me now? Okay.
Yep.
Yep.
I'm just beginning, because my progression really started at the beginning of this year, and now that we understand what's going on, that I have been looking for local support because of the class of blood cancer I have is still relatively rare. So in my local community in Silicon Valley, I am searching for a support group that I could engage with. And then also part of my strategy of doing that is volunteering to programs like you guys, having panel discussions, because if I don't tell people, then there could be somebody that could support me right in my own neighborhood. But I'm now starting to open up to tell people I have a blood cancer. And mind you, I've had the blood cancer for over 16 years. Most people never knew because it was managed. Now that it's progressing and it's more serious, I do feel that having support group members and people who understand what you're going through would be beneficial for me. And as a guy, I usually think in the past that I got this, I can handle this by myself. But I'm realizing now with this progression that my wife is a strong advocate and a supporter. She's also, a surgical nurse as well. That helps. But then now I've been open up to all my other friends to let them know of what's really going on. And amazingly, people are like, whatever I can do to help, whatever I can do to help. But would like to connect with more people who have my class of blood disorder to hear firsthand about their journey, challenges, and future.
Yeah, I think a program that we're starting to launch here at HealthTree, another shameless plug here, but we're calling them Gather Community Events. And this is really just an opportunity. It would be another webinar style, but a way for individuals to get on, talk about what they're going through. We're going to be running these for AML, myeloma, lymphomas, CLL, MPNs. So I suggest people be on the lookout for those. It's a new program that we are just kicking off, but definitely look out for those because support is so important. And I think we've talked about that quite a bit today of finding the right support does make such a difference. So we want to do whatever we can to help facilitate that, but also there's other groups out there. There's local groups, there's groups at certain hospitals. So um, finding whatever support fits right for you is so important. Um, we are running out of time here, but I want to kind of give our panelists the floor just for any final thoughts that you want people to know. So things that we haven't had the opportunity to cover, but that you think would be really beneficial for the audience. So, Harvey, do you want to start us off there?
Yeah, so I usually always tell people, all of my buddies that I've made these connections through. One of my my best partner through this has been my wife, and her support is just has been enormous. One of the things that she told me in the very beginning, and that's why I do these things, and that's why I try to make connections. Is one of the things that she told me early on, and I was really feeling down and discouraged, and I was feeling sorry for myself. Um, and I remember her sitting down with me, and she said, "Okay, Harvey, I'm gonna give you 5 minutes, and we're gonna sit here, and you can feel sorry for yourself, and we can talk about how bad things are and all the things that you want to talk about. But then we're gonna stop after 5 minutes, and I want you to go and do something to help somebody else." And so that has been the best medicine for me, is when you get into a hole, or you get into a place where you feel like you're focused on me, stop and go send somebody a note, get on a webinar, call a friend, talk to somebody to encourage them, but just do something to help somebody else. And to me, that's been one of the best medicines that anybody could ever give me, is doing that for somebody else. So it doesn't it could really be something that anybody does. You don't just have to have a blood cancer or cancer in general, but those kind of things are helpful to me. And we talk about that a lot in my groups. You know, get the focus off yourself and go and do something to help somebody else, and you'll feel so much better. That's all I've got.
From a selfish perspective, I've add to what he said, because about 50% of, I think, getting through this last year for me is mental. I mean, yes, it's physical. Yes, you go through chemo. Yes, you have all kinds of side effects, but it's mental. But as I was reading about cancer and cancer survivorship, you have a 20% plus improved outcome of cancer survivorship if you engage and get support and give support. So that builds to what Harvey says, is giving support, but also getting support. The strong silent type that doesn't talk about it and doesn't expose the fact they have cancer to their neighbors, and really keeps it all inside. It doesn't help, and it's not good for you. But the statistics show that you have a improved outcome if you can give support and get support.
And Ron, anything you want to add that you haven't had the chance to share yet? Let me give it a second, because we might be unmuting, but no. All right. Well, we did have a couple of questions. So I just wanted us to address a few of those real quick. I know that we're already a couple minutes over, so we're going to keep this pretty short. But I did want to address a few of these at least. So let's see. Harvey, we've got some interest about your coach's name, if you'd be willing to share their name. People said that he sounds incredible, so. Nope, you muted yourself.
I'm sorry. Patrick Green is my coach through HealthTree. So that's my guy here. But like I said, I've got all kinds of connections that I've just made. Drexel Jordan is the gentleman that I told you about at UAMS that I started with. So that's his name.
All right. And then trying to find one that's a little bit more general here. Um, I think we're gonna wrap up there. I do have a couple of audience members asking to get connected with our panelists. So panelists, be on the lookout. I might be emailing you, seeing if we can set up some conversations for you. So be on the lookout for my email. But thank you again all for your time. It was great to hear from you all. And Ron, happy that we were able to get you working because your perspective was really valuable today. We're going to go ahead and start wrapping up. So I did want to let everyone know about a couple of upcoming events that we have. Be sure to be on the lookout for your disease-specific events because we've got quite a few of those coming up. But I wanted to highlight just some of our cross-disease events that we've got coming in the near future. So on October 7th, we're going to be doing a bi-monthly blood cancer financial Q&A. And this will be focused on answering your treatment costs and support questions. So really good opportunity to ask those financial questions. And then on November 14th, this is one that we're really excited about, but this is going to be Empower Your Mind, journaling to build resilience for patients and caregivers. So definitely be on the lookout for both of those events if they're of interest for you. And then we do have some upcoming in-person events as well. These are going to be our Connect to Cures. So we've got September 27th in Austin, Texas, October 4th in Spokane, Washington, October 11th in Brooklyn, and November 15th in Grand Rapids. And also November 15th, we're going to be in Las Vegas too. So we're going to be busy. So if you're in any of these areas, highly recommend checking it out. Really good opportunity to meet some other members of the blood cancer community, as well as hear from community doctors and specialists at these events to how they can kind of coordinate that care and just really help build that blood cancer community. So they're called HealthTree to Connect to Cures. So be on the lookout for those if you live in those areas. They are amazing events. And then wanted to give another thank you to our HealthTree Central sponsors, Pfizer, Adaptive, Kira, Johnson & Johnson, GSK, AbbVie, Amgen, and Taiho. We wouldn't be able to do these without their support. And finally, I want to thank everyone for coming today. Big thank you to Harvey, Diane, and Ron for being our panelists. It was wonderful having the opportunity to work with y'all. You're all incredible and have such amazing stories and perspectives to share. So I'm so honored that you spent part of your time to join us today. And thank you to everyone in our audience, both watching live and watching the recording. Knowing that people are out there watching and learning from these and taking something away from this it really puts meaning into the work that we're doing. And it's so wonderful knowing that so many of you decide to spend some of your time and use HealthTree as a resource. We are always here for you. I'm not just speaking for myself here, but all of HealthTree. We truly want to be there for patients however we can be. So thank you for all of your support and for being part of our community and helping us build this community. I hope you all have a wonderful rest of your day. Hope you have a wonderful weekend. But yeah, just a big thank you to everyone.
Thank you.
All right. Thank you. And as people are hopping off, just wanted to say another big thank you, both Ron and Harvey. Ron, I'm so sorry about the tech issues, but I'm glad that you were able to at least weigh in some here because you do have a really good perspective, and I'm happy that you're able to share at least part of it. All right. Well, that's going to do it. Yeah, bye.